The surgeon who operated on himself, and lived to tell the tale. Imagine being on the operating table, and the one holding the scalpel. For one man, it wasn't a nightmare, it was Tuesday. In an era where anesthesia could kill as often as it could help, one man challenged the status quo. Dr. O'Neill Kane wasn't just any surgeon. He was bold, brilliant. At 60 years old, he scrubbed in, on himself. With mirrors to guide him, and local anesthesia to numb the sight, he cut into his own abdomen. With steady hands, he found and removed his own appendix. The surgery was a success. Not done yet, he would later perform his own hernia repair, again, fully conscious. His courage wasn't just for headlines. Kane's work helped popularize local anesthesia, saving lives, reducing risks, and transforming surgery. Dr. Kane proved that belief, skill, and a steady hand can reshape medicine. He believed in what he taught, so much, he risked his life to prove it. Subscribe to Medley with Dr. Muneer for more true stories from the front lines of surgical history.